is Fox 5 News, live in Las Vegas.
All right, Les, thank you so much. 7:40 now.
Spending a lot of time with extended family over the holidays, you might as well make the most of it.
Yeah, now's the perfect time to ask about your family medical history. We've got an expert in-house to help you choose and know how to ask the important questions.
Hey.
All right, welcome back. During this time of year, families are all gathered together, catching up and spending quality time together. But while, everyone's chit-chatting over dinner, it's a really good time, actually, to talk about your family history, get some more important information there. Joining me this morning is cardiologist Dr. Stephen Portz with Healthcare Partners of Nevada to talk about what's involved with staying healthy. What are some of the things that you really need to talk about with your loved ones?
It's a good time to do that while you're around your family. We always hear a lot of things about different health-related issues such as smoking and overeating and whatnot, but one other important piece of information is your family history and what kind of diseases tend to run in your family. It's a good time to do that while you're gathered around with the family members, such as heart disease, different cancers. Of course, I deal primarily with heart and vascular disease, and it's important to know whether you have truly genetic type diseases or whether it's environmental, such as mimicking things that your parents have taught you what you've grown up, such as smoking, lack of exercise, being overweight, that sort of thing, or do you truly have genetically bad cholesterol panels? And it's important to check those things out, know what your family history is, and see your doctor regarding those particular diseases.
Okay. And what are some of the things that people can really do to be proactive? We always know after the first of the year, gym memberships skyrocket.
Right.
But also just with your annual checkups with the doctor, having that kind of open communication with your specialists.
Yeah, those are important. If diseases tend to run in your families, or if you have any risk factors, it's important to see your doctor. Get blood testing once a year, every other year, such as cholesterol levels, blood counts, looking for anemias or different thyroid diseases depending on what's going on. Some families have histories of cancer that can be screened for genetically. You may want to look into, particularly in women, such as ovarian and breast cancer, whatnot. And then it's important to even during the holidays to try to stay active. If you know you're going to be going to a party where there may be a lot of unhealthy food, maybe eat something a little bit healthy at home so you're not totally famished by the time you get to
starving when you show up.
And then really dig into the bad stuff. So.
Okay. And lifestyle we've been talking about is so important because often so much of this can be genetic, but often it's just a lot of it's in what you eat and how you take care of yourself, how much sleep you're getting. Right.
Yeah, I think that probably 90% of the disease that I treat is related directly to smoking and eating. Eating leads to obesity, which we have a big problem with. Obesity leads to high blood pressure, diabetes, joint-related disease, heart disease. Smoking leads to high blood pressure, to lung disease, vascular disease, and it's kind of the two things that really keep us busy. Yeah,
unfortunately, because those are industries that make so much money, but also it's difficult for you guys because you definitely have your work cut out for you.
It keeps us running, that's for sure. But just over the holidays, and if you can keep those New Year's resolutions going. I know my gym's always like packed for January, then it's like back to normal in February.
Off. Right.
So it's important to do that. Also important, especially with the New Year's Eve coming, for responsible hosting, to make sure that your family or your friends aren't leaving in a state that they shouldn't be driving home in.
So make good decisions, healthy decisions all around. Dr. Portz, thank you so much for your time this morning, for coming in. We appreciate it. With that, we're going to toss it back over to Les, see how the rest of your week's looking.